I will. Okay, so thank you for the invitation for this great event. I was very happy when I've heard that I can present in my own language, so I hope you will enjoy the presentation in Polish.
No. No.
And I will ask Professor Miguel to translate it into English. So,
You'll have to pay. You'll have to pay.
bardzo dziękuję za możliwość wystąpienia w moim ojczystym języku. Tematem mojej prezentacji jest stopa i jej wpływ na mobilność odcinka szyjnego oraz lędźwiowego kręgosłupa. Dziękuję. Okay, I'm kidding. Why feet? I was interested in feet because I think most of us just forget about them. We concentrate on the upper parts of our bodies, but we forget that the most important part is our feet. Leonardo da Vinci in 15th century mentioned that feet is a masterpiece of art, and he was right. This is possible because what did you do? Okay. I have no money from this advertisement, sorry, but I wish I have. Can you skip the advertisement?
I can't.
I think I should learn from this.
I can't.
Now you can skip it. What about the sound?
Yes, इसके सब procura.
Take your time, relax. Coffee break. We can prolong the coffee break. Can we skip it? It's in Portugal, but it's different.
In fact, it's quoted as saying the human foot is a masterpiece of engineering and a work of art. And he's right. The human foot is indeed an engineering marvel. It not only supports the weight of the entire body, but it allows us to move at a range of speeds in a precise, energy-efficient way. It adapts to uneven surfaces, feeds back to our brain to maintain balance, provides leverage for propulsion, and gives us traction to move ourselves forward. Let's take a closer look at the anatomy of the foot and see just why Da Vinci loved it so. The skeletal foot consists of 26 bones. There are 7 short, irregularly shaped tarsal bones, and 19 long metatarsal and phalangeal bones projecting outwards from them. The tarsal bones resemble the carpals in your hands, and they probably come from a similar origin. The first of the tarsals is the talus, which is the only bony connection between your foot and leg. Directly below the talus tarsal is the subtalar joint, an articulation with the heel bone, or calcaneus, and the navicular tarsal, which is part of the midfoot. The subtalar joint is the largest percentage surface area of any joint in the human body, and subsequently provides a huge range of motion that can help the foot adapt to all sorts of terrains. The first and second metatarsal bones also have a wide degree of up and down motion that allows the foot to change shape with its running surface. Looking at the arrangement of the bones in the foot, we can see that the only parts of the entire structure to directly contact the ground are the bottom of the calcaneus and the heads of the metatarsals. This means all of the weight of your body that comes down through the talus tarsal is distributed into the arch of your foot before being transmitted to the ground through these points of contact. This arch structure is a great example of the genius of the foot. We know from bridges that arches are an excellent way to redistribute stress into compressive forces and massively increase the amount of strain a structure can endure. In addition to the stress reduction properties of the tarsal arch, the foot also has properties that dissipate energy before it can even reach the bones. An example of how the foot does this is through the use of plantar fat pads in the heel and forefoot. These are fibro-adipose structures that compress and deform when the foot strikes the ground, absorbing energy in much the same way as viscoelastic dampers used in earthquake-resistant buildings. Studies have shown that up to 50% of the energy entering these fat pads is dissipated before it can be transmitted to the bones of the foot. And this energy dissipation actually increases with higher running speeds. Another engineering marvel of the foot acts not only to relieve stresses, but as an energy conservation mechanism. Joining the calcaneus tarsal to the distal foot is the fibrous plantar fascia, or plantar aponeurosis. This is a fibroelastic structure that can stretch minimally when tensioned, with a powerful recoil when released. A great example of how this works is using the combined truss and windlass analogy. At rest, the plantar fascia is relatively loose, but when pressure is put onto the foot, for example during running, the plantar fascia becomes stretched and taut and begins to store elastic potential energy. This first raises the arch of the foot and makes it become more rigid, allowing the many bones to work together as one, thus reducing energy loss by bones sliding against one another and allowing the foot to act as a rigid lever that can be used to push forward. Then, as the weight through the foot is redirected, the tense plantar fascia can recoil and release its stored energy to aid in propulsion forward. The plantar fascia acting in this way is theorized to contribute 8 to 17% of the mechanical energy required for each step, as well as acting to turn the foot from 26 individual bones into a single unit and back again, rapidly as the gait cycle repeats. Da Vinci was right to be impressed by the engineering of the human foot. It's clear that evolution has crafted it into a masterpiece of energy dissipation, redirection, and conservation. These mechanisms are probably some of the factors that contributed to human beings becoming the best long-distance running animals on the planet, and are at least partly responsible for our advancement up the food chain to become the dominant species we are today. So next time you're out for a run, have a think about how clever your feet are. Marvel at their design, and see if you can think of ways to apply what their anatomy has taught us to new, novel situations. Make Leonardo da Vinci proud. If you like this new style of video, remember to subscribe to our channel and drop...
Okay, so there was mentioned that there are very important functions of our feet, right? The locomotion one, the supportive one, and there's also thermoregulatory. And when we are laying down under the very warm blanket and it starts getting too hot, the first part of our body that goes out from this blanket is our feet, right? So in literature we can find 3 arches in our feet, 2 longitudinal ones and 1 transverse. But we can also find the data that shows us the 4 of them. These lines form the tripod, foot tripod, that help us to move. And here is the 4th one that we are working in our research. So we chosen 2 longitudinal lines and 2 transverse. Also, we were focused on the heel. So the foot tripod as a very important contact of the ground. And if we divide the foot on a forefoot and a rear foot, what do you think? How can we share the percentage of the loading of our foot? How would you divide it?
I would say 70% rear foot and 30% forefoot.
Okay, and more ideas?
During running or walking?
Standing.
Oh, okay.
Yeah, I agree that it's 50-50. Okay, but then we've got the forefoot. And if we divide it into two, how do you think? Shall we divide it equally?
No,
Or there's a difference?
there is a difference.
But in the standing position.
It's the lateral side has more weight, so not the medial side. The lateral side has more weight.
How would you divide this 50% of
I would say 35-15. So on the outer side it's 15, and on the inner side. From
okay.
this perspective,
It's just idea.
for me it's on the lateral side, more on the lateral side. So towards the little fingers we have more weight here.
Mm-hmm. Any ideas? More?
Is this the inner side? This is the outer side?
Inner side is the right.
Yeah.
Inner side is the outer side.
Inner is the right.
Yeah.
So how could we divide this 50%? 35-15? Or you have another ideas?
Barefoot, or this depend on the shoe you're wearing?
We will talk about the shoes. It's 20-30.
It's close.
20-30.
You were very close. And a very important part of our feet is plantar fascia, which gives the support of all arches on the feet. It also absorbs the shocks and help us move by rolling the foot. It connects also with the heel.
Our videos are a collaborative effort between certified foot specialists, doctors, industry experts, and top-tier animators fully educated in the medical field. The video you are about to see gives a visual explanation of plantar fasciitis and a heel spur, followed by how fascia bar technology can treat, heal, and prevent these conditions. The average healthy foot has strong and flexible muscles and ligaments. In the case of plantar fasciitis, the main ligament affected is the plantar fascia. The plantar fascia connects the heel bone, or calcaneus, to the ball area forming the main arch of the foot. The plantar fascia ligament is made of small fibrous tissue and is most commonly injured due to a loose hind joint complex potentially resulting from obesity, overuse, or worn out or ill-fitting footwear. When this area is loose, the foot can move too freely, causing the plantar fascia to be stretched to its limits, developing small tears and pain. These tears are difficult to heal and can become inflamed. Different stretches and icing for 20 minutes twice a day may help to reduce inflammation. Heel spurs are a calcium buildup on the heel bone that can grow into a shelf or pointed formation. For example, a heel spur on the front of the heel bone would begin to poke into the fat pad. This can be extremely painful with every step due to the spur being compressed by the body's weight into the surrounding soft tissue areas. These painful conditions can hinder a person's daily routine by requiring stretching, icing, prescribed orthotics ranging from $200 to $600, and possibly cortisone shots or even surgery. The fascia bar is a patented revolutionary design tested and clinically proven to treat, heal, and relieve patients from both plantar fasciitis and heel spurs. The fascia bar applies an acupressure relief directly to the hotspot areas. This lifts the plantar fascial ligament to its natural position and realigns the biomechanics of the foot for optimum treatment and results. Pressure from the fascia bar on the calcaneus keeps the spur lifted off of the painful heel pad even while standing. Thicker walls around the heel area help rebuild the fat pad for fast, natural healing. Fascia bar technology was invented by one of the top foot orthotic specialists in the world. It was also clinically proven and tested by professional athletes before going to market. This is a therapeutic design and should be worn as often as possible. Rapid results can vary from instant relief up to 7 to 8 days. Thank you for watching, and let's heal.
The heel is also connected with Achilles tendon that leads us to the anatomical trains or anatomical lines, as you wish. But for me, and today the most important is the superficial backline that starts with the feet and finish on the top of our head. This one is good.
Superficial backline. Superficial backline is one myofascial continuity from the bottom of the toes to the back of the head. The superficial backline has a strong postural function. You cannot develop lying on your back, lying on your stomach, sitting, progressively standing and walking without the superficial backline being constantly engaged and in coordinated way. If you were to contract the entire superficial backline, you go into a back bend, a forward bend that stretches it, and it is all extensive except for the genetic flexion at the knee. It starts with the plantar fascia and the short toe flexors, continues around the heel and onto the Achilles tendon, which splits out into the gastrocnemius and soleus muscles, which are interlocked with the hamstring at the knee and pass over the posterior side of the ischial tuberosity onto the sacrotuberous ligament and then onto the sacral fascia, which is the basis for the entire erector spinae complex and the multifidus underneath, going up to the neck extensors and the suboccipital muscles beneath these extensors and onto the cranial fascia. The finish of the line goes over the top of the skull and attaches to the temple brow ridge.
Rear view of the superficial backline, SBL, which begins at the head extensors and descends through the erector spine into the hamstrings, the gastrocnemius, and the foot muscles. In this chain, the muscles are connected to one another and function as one unit. Wide-legged forward bend, Prasarita Padottanasana. The superficial backline connects and protects the entire posterior surface of the body like a carapace from the bottom of the foot to the top of the head in two pieces, toes to knees and knees to brow. When the knees are extended, as in the current pose, the superficial backline functions as one continuous line of integrated myofascia.
The second important is the spiral line, which also goes for our feet.
The spiral line wraps itself around the trunk from the head to the iliac crest and keeps on going, forming a kind of jump rope or sling that supports the arches and is wrapped tightly to the ankles and then back up to the posterior part of the pelvis, across to the other side and up the erector spinae to the skull. Let's start with splenius, capitis, and cervicis. It goes right into the rhomboids on the opposite side, into the serratus anterior. All this we've dissected many times. Into the upper fibers of the external oblique, across the linea alba, including the rectus abdominis, to the opposite fibers of internal oblique, onto tensor fascia leva and the anterior part of the iliotibial tract, following tibialis anterior down to the medial arch, picking up the peroneus longus tendon on its other side and going up to the fibular head,
joining this time the biceps femoris, outside hamstring, onto the sacrotuberous ligament, cross to the dorsal sacroiliac ligament, and up with the erector spinae on the other side.
Okay, so my question is, as we saw, the feet are very important. We can influence whole body because of the body lines by working on the field or on the area of our feet. So my question is, have you ever did inspection of your feet with professionals, like orthopedists or orthopodists? Did you? One person. Yeah. My question is, I think, quite important because we remember about our feet when we feel pain or we are injured, but we need to remember that it is first contact with the ground with each step we take. So, how about your car? Do you do inspection of your car every year or not? In Poland, you must. You can drive your car without the inspection of it each year. So I want to invite you, encourage you to do this inspection of your feet just for yourself, just to know, just to do something for yourself. So now, I would like to invite you to that very simple body inspection. Can I ask you to stand up? Maybe in the first line, I will ask you to go down because for a moment we will close our eyes. So for your safety, okay? So now, please stand in comfortable position for you. And please take a look on your feet. If the toes are in the same line or one goes forward from another one.
Same line? Same line?
Okay.
You mean line like this?
Yes?
Yeah, that's fine.
Okay. Because if there is a difference, it can point that there is some rotation in your body. Okay? Then, please close your eyes. And let's scan our feet. How about the load of your forefoot and rear foot? Is it the same? Do you feel 50-50? Or you should divide it in a different way? Is one of your foot more weighted than the other one? Or they are the same? Let's go up. Knee position. How about the knees? Are they bent or are they straight? Are they rotated inside or outside or not? Okay, let's go higher. Hip girdle. How do you feel it? Please don't open your eyes, just try to feel it. Is it forward or backward? Is it rotated or not?
No.
How about your pelvic position? How do you feel it? And let's go higher to the shoulder girdle. Are your shoulders on the same height or one of them is higher than the other one? Are they in the same line or one is forward or backwards? And let's go to your head. What is the position of your head? Is it straight above your body or does it go forward and backward? Or to one of the sides? Is it rotated or not? Now you can open your eyes. And thank you for your activity at the moment. This kind of tests we can do with the use of different forms of activities. So we were doing it before and after rolling the body with the balls, and the effect was immediately. So we can correct our body position in a very simple way. We need to be aware. How does our body shape? Another very easy test is your shoes. You can look at the back of your shoes after using them for some time, and it's very good information for you if your feet are in pronation, supination, or in a neutral position. The best option is when it's scratched in the same shape, only in the back, not from right or the left end. Okay, if you scan our body, we know that our body posture is quite good. We can go to the recommendations. Yesterday and the day before, we've heard about the recommendations of the World Health Organization, but the most popular amount of steps that we should make is 10,000 steps per day. Do you agree that you've heard about this?
Yes.
Yeah. But for many people, it's impossible to achieve this amount of steps. So every step counts. We have many devices to count our steps for us. We can use our watches, pedometers, or our telephones. And the great achievement that I made in the first quarter of this year, I found it unintentionally in my phone. I didn't know that it was counted my steps. So it seems like I made in 4 months 1,070 kilometers on foot. During the month, it was 400 kilometers, and I was able to do 44,000 steps during the day. During the week, I made almost 110 kilometers on foot. And when we add different activities to it, like running, jumping, kicking, there are great forces going to our body. What if I add to all these activities overweight, obesity, or maybe more difficult activity like ballet? If my feet could manage to achieve these loads? To answer this, I need to go back to the first slide. Yes, they are genius constructions, so they would manage. But the forces are going higher. By the anatomy lines, we have effect in the upper parts of our body. So, if we have disturbances in our feet, we can see it, we can feel the pain not only in the area of feet, but also in our back, in our head. We can have bite defects. So it has really great influence on whole our body. So foot disturbances can make a range of problems with the structure, function, and health, not only in the foot, but in whole our body. So there are many different disturbances, problems in our feet. They are divided into different groups, like structural disorders, functional deformities. But if we think about, for example, ingrowing toenail, it can make such a big pain that we will avoid contact with the ground, so there are go compensations to other parts of our body. Also, the illnesses, diabetes, or maybe hallux, it's very popular in our society. So the shape of our bodies is an effect of our activities for all life long. It depends on us, but it also can depend on the tradition. Look at this Japanese food. So seniors' feet can have very different shape. It's connected not only with activities but also with diseases. For example, mentioned diabetes. And our shoes doesn't help us with it. And another question for you. Have you heard about barefoot shoes? Do you use them? No? Okay. So maybe we should think about it, right? Flip-flops. Do you like flip-flops? I do. But during summer, yeah, I think that they're very popular during the summer. But it causes a lot of problems. It can cause a hallux problem. And the same, because when we put something between our toes, it makes the increasing tension between these toes. So the problem with hallux is increasing. So if you want to choose the separators to correct the shape of your feet, don't use this one. Choose 5-toe separator because it works on all toes and increase the shape of our arches of our feet. High heels. It's the best part of our outfit, right? But it doesn't work good for our body. And here I have a slide of a great biomechanic who can explain you the effect of the high heels with the biomechanical side. And he will also tell you that it's not a problem in the feet, but in your spine. Unfortunately, he is on this table, Professor Orlando Fernandez. Online we have a lot of possibilities to work with our feet. It depends on us if we choose to work with our feet or not.
To deal with these symptoms, we have to start from the ground up and ask ourselves, is the foot flexible enough, strong enough, connected to the brain?
There is another important part of our feet, that they are connected with the organs of our body. So if you have some painful place at our feet, we should check if it's connected with, for example, liver or different organ of our body, and think about testing it. So, what can we do? We can try to walk barefoot. We can try to buy and wear barefoot shoes. We can choose the massage, self-massage, stretching, rolling. And I'm going to the practical part of my experiment. It was led with Dominika Puczko and Łukasz Radziemiński in my university. It was connected with foot relaxation and mobility of the cervical and lumbar spine. the aim of this study was to assess the effect of self-massage and the range of foot motion in the cervical and lumbar spine. The methods. So it was an experiment. It was only one training session, lasted about 25 minutes. It was started with general warm-up on the methods of Wachrenowska feet. It was 14 exercises in this part. Then we taken measurements of SFTR methods and sit and reach forward bend test. Then we were working on the feet for 20-25 minutes with the tough ball, and then we repeated the tests. We worked with 4 lines, arches of our feet, but also created the straight line, and we started with it at the beginning. If there was a painful place, we asked the participants to work on it in this place, just to feel release in the place that we are talking about. So the SFTR method shows us the rotations in different lines of our body with different degrees, and then we took the test from Eurofit. There was 31 participants, the women aged 20-85 from Gdańsk, and they were divided into experimental groups. One was the students group and the second one was the senior. There was similar number of participants in each groups, and there was no health disturbances to take part in this experiment. So the analysis in the cervical spine, in the left rotation, we can observe that in all the group, so it's the first fatigue figure, it shows that during the 25 minutes we could have increase in each groups. So in all of them, the seniors one and the students one. The bigger effect was achieved by students. In the right rotation, the seniors achieved very similar effect to the student groups. And if we take into account the cervical spine, in seniors with the blue color, we can see the statistically important effects. In bend, straight, left side bend, rotations in both groups. If we go to the thoracolumbar spine, in the left rotation, it was almost the same effect in both groups, in seniors and in students. The right rotation was much better in group of students than in senior group. And in the sit and reach test, we could achieve 4 centimeters effect in 25 minutes in both groups. So in the end of the experiment, we could see the statistically important changes in cervical and thoracolumbar spine in most of the tested movement. And I didn't add it in before that every test was repeated 3 times to exclude the mistakes. Going to feet, we are checking the foot flexion, so it was important also in the both groups, but twice bigger effect was achieved by students. In foot extension, we can see quite similar effect in both groups. We didn't see the effect statistically important in the students group, in flexion and supination pronation. Okay, the rest was important. So going into conclusions, we can see that self-myofascial release influence the relaxation of the whole back line of our body. And this effect is achieved regardless of age. The foot relaxation can most significantly affect the rotation range of the cervical and lumbar spine. And there is needed more research to see if the effect stays with the participants or not, and to obtain if the duration of the achieved effect. I don't know if we have time to see another film. Do we?
Yes, we do, because, 5 minutes. And
Okay.
then we can.
So this one will be about the barefoot shoes, because I would like to encourage you to choose this one. Yeah. Can we skip? Can we skip them? No? I can see it. Okay. Sorry about this.
Did you know that a lot of our foot pain, back pain, and knee pain may be caused by our shoes? Shoes were originally crafted thousands of years ago to protect our feet from the elements. But now we have shoes that are more of a fashion statement and others that provide the ultimate cushioning experience for our feet. Now, I think there's a time and a place for these sorts of shoes. But transitioning to barefoot shoes over 5 years ago was probably one of the best decisions that I've ever made. So what's the problem with modern shoes? Modern shoes often have thick, inflexible soles, raised heels, and a constricting design with a narrow toe box. This lack of flexibility and that narrow toe box compromises natural movement, and a raised heel robs you of your natural spring. And it seems like shoes have more cushion than they ever have before. This is all making our feet weaker, and having weak feet keeps us buying more supportive shoes. Poor foot health is a major contributor to a lot of the issues that work their way up the kinetic chain. So your ankles, knees, hips, and spine can all be impacted by weak feet. Barefoot shoes bring us back to the basics. They have a wide toe box so your feet can splay naturally. They have thin, flexible soles so you can feel connected to the earth. And they have what's called a zero-drop heel so that your heels are in line with the balls of your feet. Barefoot shoes aim to allow you to move your feet the way that you would if you were barefoot. Shocker. So I jumped on the barefoot shoe bandwagon over 5 years ago after reading Katie Bowman's book, Move Your DNA. It is a great book, and I highly recommend it to anybody who is interested in learning more about natural movement. These were pretty popular at the time, and while they are comfortable to walk in, they're not the most socially acceptable shoe. This prompted me to get my first pair of Vivo barefoot shoes, which are a little more socially acceptable, minus the fact that these particular ones are neon. Now I plan on making a dedicated video all about how to transition to barefoot shoes, but the most important thing that you should know is it is a slow process. You're retraining them from years of being confined in modern shoes. And everybody's journey looks different. Since I live in the city and I primarily walk on concrete surfaces, it took me about 3 years to get to the point where I could comfortably wear barefoot shoes for longer distances. And over the last 2 years, I wanted to test my endurance and challenge myself to walk 50,000 steps in a day and 75,000 steps in a day in barefoot shoes. I documented both experiences on my channel if you're interested in checking those videos out, but I will say this is something I never, ever thought I would be able to accomplish, even before my barefoot shoe journey. And I'll say, walking around primarily on concrete with 5 millimeters of thickness between you and ground is no easy feat. Okay, I'll maybe stop with the puns, no promises. Needless to say, my feet are stronger than ever, but there have been a few surprising changes along the way. Let's get the obvious change out of the way. I cannot stand how my feet feel when I wear traditional shoes. So I'll wear heels if I have to go to a fancy event, but I am so much more aware of how smushed and confined my toes feel, and I feel really disconnected and just far away from the ground. And honestly, I've never been very good at walking around in heels, so this is just a skill I'm probably never really going to develop. But I think one of the most surprising things is that most of my old modern shoes don't actually fit anymore. Now, my feet didn't actually grow, but really they just returned to their natural state and how they're supposed to be because I'm not wearing constricting shoes anymore. At this point, I've probably gotten rid of 85 to 90% of my old modern shoes, but thankfully I do have some that I kept onto for nostalgic reasons. So when I got married in 2018, I got these Vans for the wedding reception. I had these exact shoes in high school. They don't make them anymore, so I got them custom made. I was so excited, and they don't fit. If I put my foot up to the heel, it's pretty clear that these shoes are far too small. I'll go ahead and put these shoes on. I want you to know that my toe is jammed to the very, very front of the shoe. It is so uncomfortable. I kind of freaked out when I realized the majority of my old shoes didn't fit anymore, and that's when I looked it up and I realized, oh, this is actually a thing. So it can happen. Now here's something that can be classified as correlation and not necessarily causation. But I have noticed a significant improvement in my posture, and I hold way less tension in my upper back. If you've been around my channel for a while, you'll know that I've struggled with neck pain for several years. I'm talking since like 2013. It's 2022 now, but the state of my neck and my upper back has drastically improved over the last 5 years. I think a big part of this is going to a different chiropractor, and I've been working on my posture. But because most modern and traditional shoes have a slightly elevated heel, we're not standing or walking the way that we naturally would. And as I mentioned earlier, these little changes can work their way up the kinetic chain. So I don't think barefoot shoes are the sole reason for my neck pain improving, but I think they have played a role, particularly with the zero drop heel. Obviously, I think barefoot shoes are great, but there are some drawbacks. First is the price. They're oftentimes more expensive than regular shoes. And while there are some cheaper options out there, a lot of times you're sacrificing quality and the shoe won't last as long, or they just don't look as good. Something a lot of people complain about with barefoot shoes is that the sole of the shoe wears out faster than their traditional counterparts. And I think it's more noticeable because barefoot shoes have significantly thinner soles. So because there's not that much material there to begin with, they're going to wear down faster. Another drawback is style. Now this is all personal preference, but you do have the barefoot look, but some barefoot shoes also look kind of like clown shoes. Thankfully these days there are brands that have come out with some really great looking models that don't scream, hey, I'm wearing barefoot shoes. They look normal, they can blend in. There are tons of casual and athletic options, but I haven't found as many for those dressier occasions. There are barefoot shoe ballet flats as an option. They work for some events, not all events, for me personally. If you're interested in starting your barefoot shoe journey, there are so many great shoe brands to try out. My personal favorite barefoot shoe brands are Vivo Barefoot and Fieldgrounds. I think Vivo Barefoot uses more durable and sustainable materials, and they also have a wider selection of models. And Fieldgrounds make shoes that look most similar to modern shoes, so I think they blend in a little bit better. They're insanely comfortable, and I do think that the toe box is just a little bit wider. Like I said, there's so many great barefoot shoe options out there, but if you are interested in Vivo Barefoot or Fieldgrounds, I do have some links and discount codes in the description below. Our feet are our foundation, and this journey has helped me really appreciate just how important our foot health is to our overall well-being. I never realized how weak my feet had become, and I am amazed at how strong they are now. So as cheesy and as cliche as it sounds, wearing barefoot shoes really has changed my life for the better.
Muito obrigada pela sua atenção.
We still have some time for questions if you want to do it, please. think you ready for the questions. Is that right?
Always ready.
Only two questions. Two questions.
Two. Only two questions.
So, obrigado for your presentation, or obrigado, I think. I just wanted to share one idea I had when watching the video, and what I was, I think, missing in the end when this girl talked about the disadvantages of barefoot shoes. One that wasn't mentioned, which I think is really important because I was speaking to my physiotherapist also about, is that if you weigh a little bit more, you're either obese or overweight, barefoot shoes can actually be a problem for you. Because our feet, from evolutionary biology, were not designed to walk on a hard street. We were growing up from apes walking on earth and sand and wood and other materials which were a little bit more soft on the foot. And then if you weigh a little bit kilograms more, you aren't having enough energy dissolution to reduce the impact of your heavy build on the joints, on the ankle and on the knee joint. And then over a few years, this can actually lead to degradation of the joints, and you will develop, I think it's called arthritis in English, if you are not careful with strengthening your surrounding tissue enough. And I just wanted to ask what your opinion is, if you've heard of that phenomena before.
Thank you very much for your question. It's a very good one. Talking about people with obese, we should take into account the idea to lose your weight, right? Because the forces of all the joints of your spine, of your organs, which are always full of fat, it will be easier and better for you to lose your weight, to trying to find a weight, and then just wear this kind of shoes, maybe. Or just go barefoot anywhere it's possible. Did you try? Are you walking barefoot besides of the beach?
You love to walk on the beach.
In the room.
So I think that we should reconcile it.
Reducing the weight, I think, is always a great option to increase your physical well-being, for sure. Thank you for answering.
Thank you.
What more? I think
Thank you. I was a little surprised. See, those who are not that natural art, they are some of the people, the common man, without having that natural art. What exactly have you included some of the exercises for them, and particularly do you come across some shoes that can have a natural arch for them to help them to build that natural arch?
I have a lot of exercises in my head. It's a field of my work to give the exercises appropriate to the health problems with seniors, or it doesn't matter, the age, it doesn't matter. So I think that we should think about different kind of activities, like in the aquatic environment that was showed yesterday by Nunu Batalia. We should also take into account different activities, so increase our energy expenditure during the day by different forms of activities.
Any special shoes ready for that?
The best option is to work bare shoes, without the shoes, barefoot, right? Barefoot, without the shoes.
okay. It's like the president said before, it's two questions, and then he look at me and say, well, one more. One more. But let me tell you about something. There's a good biomechanist. He was from Switzerland, but working in Adidas for a long time. It's Benoni. He had some work with the circus in Canada, and what he found is the level of the new injuries in the food, and it's the people that choose a floor with more flexibility. And then those who have less injuries is the one that choose the hard place on the stage. That was a very interesting work because it told that the muscle needs to turning for respond the information from the ground. And sometimes the shoes don't do that, so probably it could be a problem. So Benonique, it's a very good one to read about. Sorry, Maria.
I love it.
One question more? Professor.
It's not only a question, but there is a lot research done. You can find it in dance literature. The dancers, they research already for years about the feet because they dance with the feet, they need the feet. And it's not only the weight, yeah, if you have a high body weight, the dancers normally have less weight and they have also ill feet. I think I recommended to you, especially to give some more good recommendation also for the seniors, for the whole population, to find out what the dancers recognize to make better and more. There are very good methods for training for the feet included.
Just see Nureyev and then we know how the food works. It's very interesting. Thank you. Monica?
Maybe we'll check it this night.
Maybe tomorrow. Any questions? Monica?
Thank you very much.
Dziękuję.
Dziękuję.
Dziękuję is thank you, I suppose.
Thank you.
Is lunch time or what? No.
Yes,
I suppose it's another one.
Young man, don't forget this.
I'm so sorry. We will finish the morning with the last presentation. We have 40 minutes. It's good. And the colleague comes from Pakistan, and her name is, I think, I don't know, I say it's good. Inayat Shah. Yes, good. Inayat Shah from Pakistan. Ahora desde Pakistán vamos a tener el compañero Inayat Shah, que va a hacer la última presentación de esta mañana. Desde o Paquistão temos o companheiro Inayat Shah, que para mim é um prazer ter aqui os colegas do Paquistão e do Egito também. It's for me, it's for the network, a pleasure to stay here with us, the Pakistan and Egyptian colleague, and other to the parts of the world. Thank you very much, and all is yours.
Thank you. Thank you. And I will be here to help you in the say. Please, 5 minutes. That's fine. That's not.
I'll try my best to finish within 30 minutes. We'll have 25 minutes to give you at least 5 minutes for the question and answer section. No, so while we are starting, the majority of you might know about the box breathing exercise. How many of you knows about box breathing exercise? Okay, so we have one. Okay, so we will do a box breathing exercise and we'll get started. It is said that box breathing exercise is the best exercise for making people attentive. So how we do it? We'll have like a 4 second of breathing in, then another 4 second of holding it, then 4 second of breathing out, and then 4 seconds of holding. Okay? So 1, 2, 3. Hold. Breathing out. Hold. Breathing again. Hold. Breathing out. Hold. That's it. Yeah, that's fine.
Sorry.
So, that's my name. My name is Inayat Shah, and I'm actually a professor of physiology and director at one of the medical university in Pakistan. That's called XVII Medical University. The next one, please. And the topic is beating pre-diabetes with exercise, and why it's an area of concern for me, and why is it an area of concern for me? We go through the demographics of Pakistan. So we are the world 5th populous country, so having a population of 51.2 million. Yeah, similar to Brazil. So the males 129 million and the females 122 million. We have about 50 years. Majority of the population is condensed around the age of 20 to 50. So we have a lot of young population. But then above 50, we have 22 million. That's just 11% of the country population, but that is more than the population of Portugal. I assume that's more than, it's 10 million in Portugal we have. So, and we have a great burden of NCDs, so non-communicable diseases. So in fact, the recent survey says that 59 to 60% of the deaths are due to non-communicable problems. So that is why, and the tops are the diabetes with 18%. So we had a survey from our university, and that survey was conducted in 2018, and it was a survey with a multi-stage clustering sample size of 22,000 households all over Pakistan. And we did find that the diabetes is around 18%. If we compare it to the world burden of diabetes, so we have 537 million people with diabetes across the world, which is 1 in 10. But in Pakistan, it is 1 in every 5 which is diabetic. So we are at the top of when we are saying about the diabetes burden across the globe. Pakistan is at number 1. So hypertension and IHD, of course, at 21 and 17%. Can you go, please? Okay, so pre-diabetes. Now, I'm very much interested in pre-diabetes, and pre-diabetes is actually, when we're talking about the diabetes, we're talking about type 2 diabetes. So pre-diabetes is actually a preclinical stage of diabetes that is manifested by few of the parameters. So according to American Diabetic Association classification, they say that if somebody is having a fasting blood sugar of between 100 and 25, or HbA1c level between 5.7 to 6.4, is a person who can be classified as pre-diabetic. And if not prevented at this level, majority of them, in fact 90% of them, changes to diabetes over a 2 years period of time. So I discussed about the diabetes and disease burden in Pakistan. So from that survey in 2018 that we did find that in fact, along with the diabetes, we have a 21% of prevalence of pre-diabetes as well in the people who are 30 years age, which is very alarming. The risk factors, everyone knows about the risk factors of the pre-diabetes, and along with the genetic component. Yeah, they say that South Asian population do have a thrifty gene, which is somewhat involved in having more diabetes as compared to the people around the globe. And of course, the people with disability due to diabetes. So again, the dialysis or the disability adjusted life years in Pakistani population are more when we compare to the rest of the world. But it also actually put an enormous burden on the health economics. And the Pakistani health system is more of a responsive one. So if somebody is having a disease, it will go to the doctor, that will treat him. Not on the preventive side. So I think we require a lot of shift from the response to the preventive side of the health system. And you know, if we take only the diabetes, so 95% of the raw material which are used in the medication of diabetes are actually imported from other countries. So that is why it is posing a lot of economical burden on the health system of Pakistan as well. Next, please. So some of our previous work, we actually find out, and that was like, you know, it was not meant to, we were just looking at the effect of short duration moderate intensity exercise on the glycemic control and antioxidant status of pre-diabetic population. And there we find out, some of the major findings were that 52% of the population actually converted from pre-diabetic to normal glycemic status, and that is over 3 months of a study that we had. While the other 48%, they didn't actually came into normal glycemic status, but their glycemic indices were improved, and that is why we found that why not to find a specific exercise, like a personalized type of exercise for the people who are pre-diabetics, and that's why we designed another study, which is this project. This project that I'm talking about is, well, actually not having all the results yet, but we are working on it. Okay, so there are some data which I can share today. The question is, why specific? And there is a video, a very good video, which has actually made me to think why specific. Can we have that video? Excuse me?
Sorry.
Can we have the video?
Sorry, yes.
Yes.
Yes, just one moment.
It's a bit like 6 minutes video, but it's a nice one. You will enjoy. You will enjoy. Why specific?
No, sorry.
So why specific?
Okay, yes,
They haven't paid me anything.
Step 1. Get 2 pieces of bread out. Got him.
This dad is teaching his kid a very valuable lesson, but the way that he does it is hilarious. Take a look at this funny video.
No, Dad, wait, the peanut butter.
I'm just doing what it says. It says take 1 piece of bread, spread it around with the butter knife.
Hold on.
Get some jelly, rub it on the other half of the bread.
No, Dad, open the jelly.
It doesn't say to do that. Put the breads together on top of each other. Take a big bite.
Sorry, I had to make it extremely specific.
Oh, good. I'm starving. Take 2 pieces of white bread out of the bag. Take the lid off the jar of peanut butter. Get a butter knife and stick it inside of the peanut butter jar. With the knife, scoop a bit of peanut butter out of
Big, that means like a lot.
A bit means a lot.
In my world.
There we go.
Doing better than before, though.
Open the jelly jar. Squeeze it onto the other piece of bread.
No.
Done. Closer. Brad, get us some peanut butter.
That's why we need to be specific. So that's why we designed this other project, and this project has been actually supported by the Higher Education Commission of Pakistan. So what the objectives were to evaluate effects of aerobic exercise on insulin sensitivity, glucose level, lipid profile, microRNA 192, 193 as well, and cardiorespiratory fitness in terms of timing, intensity, and duration of exercise. So we were looking to a very holistic picture of what we can do about the pre-diabetes. And importance is early intervention can prevent progression to type 2 diabetes. Next one, please. So it's an experimental lay-based design with crossover design. So we had all those 25 people who were pre-diabetic and who agreed to participate in the study and who were actually according to the inclusion criteria. So we took them and we asked them to attend overlap for 13 times over a period of 3 months. So like the first time they were coming for their baseline assessment and their conditioning to the lab and the equipments and everything. And then after that, every week they would come for whatever we are doing. So we will be discussing what exactly are we doing with them. So we were actually focusing about the timing, what would be the better time of an exercise postprandially. And after that, when we find the optimal time of exercise, we focused on intensity. What should be the intensity of the exercise for the people who are pre-diabetic? And then after that, we took into the duration for how long they should have the exercise. The outcome measures were, of course, glucose, insulin, C-peptide, lipid profiles, and all these things. Next one, please. So, for their respiratory fitness and finding out the metabolism, we use breath-by-breath analyzer. For the microRNAs, we use the RT-PCRs, autoanalyzers for the lipid profile, ELISA for, there are other parameters as well, which were not mentioned in here, and glucometers were used for RBS and FBS. Of course, COBAS as another machine that was used for the HbA1c. And we also took the International Physical Activity Questionnaire from these participants in order to find out what exactly is their physical fitness or behavior. And the PARQ. So PARQ is basically Physical Activity Readiness Questionnaire. So to find out if they're ready to do the exercise or not. Next, please. That's enrollment. So we actually assist 190 candidates and we screen them. And eventually we came with 25 participants and we put them into timing protocol first and then intensity protocol second and duration protocol third. But you should keep this in mind for the timing protocol because we were not having any intensity in any duration. So we followed the WHO criteria, and that's like moderate exercise, 50 to 60% of the max heart rate, and the duration we kept as 30 minutes. Okay, next please. So for the timing exercise, so they would come like every week. So for the first week when they came and fasted. So we provided them with or what we call as the caloric, so pre-measured caloric food, isocaloric food. And after that, we wait for 30 minutes. And after 30 minutes, we ask them to do the exercise. The next time when they came, we provided them with a breakfast, which was again an isocaloric breakfast, and we asked them to wait for 60 minutes. And then the next visit, we asked them to wait for 90 minutes, and the next visit, we asked them to wait for 120 minutes. And all the exercise was at 50% of the predicted maximum heart rate. So when we find out from this timing exercise, next time for the intensity, then we start getting up with the intensity. So we put them on 50, 60, 70, and 80. And the last one was for duration. So we had these for 15, 30, 45, and 60 minutes for the exercise. Next, please. Okay, so this is actually changes in their body composition over 3 months time. So that's before intervention and after intervention. And this was not the objective. But we find out that over 3 months, there were changes in their weight, BMI, waist and hip circumference. So we observed all these changes. This was not one of the objectives, but these are the changes that we could actually find out at the end. Next, please. So these, from the timing exercise, what we found that these are the timings. So visit 1, visit 2, visit 3, and visit 4. It says like visit 1 is 30 minutes, visit 2 is 60 minutes, 90 minutes, and 120 minutes. So we can see that the blood sugar level, insulin level, and the C-peptide level. So all these 3 parameters were taken into account to find out which timing of the exercise is the best in postprandial state. So we find out, if you see, go to the blue one, so we find out that the blue one is basically giving us more area under the curve, which is like, pointing out to be more effective in postprandial state. And that one is the Borg Pursuit Exertion Scale, so like, to find out how they were feeling while doing the exercise. Next, please. These are the lipid profile parameters, and you can see that almost all of them got changed. Next, please. And this is actually their cardiorespiratory fitness. So this is just a data. We haven't worked on it. We are publishing this data, but this is just like, to portray. Yes, next, please. So, yes, the microRNAs. We, while searching or going through the literature, we came to know that microRNA 192 and 193, they are found in people, their expression is more in people with diabetes. So we took into account the mRNA as well to find that is there any relationship of mRNA with exercise. And ironically, we find out that the mRNA, with almost each and every, like 30 minutes, 60 minutes, the next two, please. The next slide, please. With every exercise, you could find that there was a decrease in expression of the mRNAs. Next, please. So, from that, when we got that 30 minutes postprandial is the best time for exercise, we start the second phase, and the second phase was about the intensity of exercise. So we asked them to have the exercise at 50, 60, 70, and 80 of the predicted maximum heart rate. And from here, we can see that, again, the blue, the 70%. So 60 to 70% was found to be more beneficial for these people. So we can see all these things. The problem with the 80 looked to be more promising, but the problem with the 80 is that a lot of people were not able to continue with the 81. So that is why we stick with the 71. So from here, we find out the intensity of the exercise. Next, please. Again, this is the lipid profile, so hold on, talk about it. Next, please. Respiratory fitness, and you can say that the respiratory fitness is increasing. Next, please. Again, with mRNA, for these ones as well, again, the expression is getting down. Next, please. Next. So, when we got the timing and we got the intensity, the third experience was, this experiment was about how long it should be. So we asked them to have it for 15 minutes, for 30 minutes, for 45 minutes, and for 60 minutes. And again, if you see to the blue, that is visit 3, 45 minutes of exercise at that intensity and that timing was the best for the people or the pre-diabetic people. So, please, next. Next again. Next. Again, we have actually found a lot of differences in the expression of the mRNA as well. Next, please. Next. So the key outcomes were timing. So exercising 30 minutes post-meal significantly reduced glucose level, and density, 70% were found to be the good intensity, and duration of 45 minutes. Now, question comes, and that is like, one of the questions which is usually asked, that WHO asks people to have an exercise at around 50 to 60% of the predicted maximum heart rate, and for 30 minutes a day. Now, why are we like, would be asking people to have exercise at a bit higher intensity and for a bit longer time, duration? And I was searching for all this, and then while I was thinking, came to my mind that just imagine when your car is stuck in the mud, you have to push more. So when your car is stuck in the mud, you have to push more. So that is why you requires, in order to get out of this status, your body requires more of the exercise. Your body requires more of the exercise for a longer duration to get out of the pre-diabetic status into diabetic normoglycemic status. So these were the key outcomes. Next, please. So the publications from our study, and there are other, because we haven't taken the cardiorespiratory fitness and the lipid profile fitness and all these things yet to account. So we'll be working on that as well. So we are expecting another 2 to 3 publications from the same study. Next, please. And so usually my take-home message to the people is, it's not diabetes that runs in family. It's because no one runs in family. Yeah. So with that, I'll finish my talk today. Thank you so much for listening to me. If there is any question, next, please. These are the branches. Next, please. Thank you.
Thank you very much for your presentation, and thank you very much for your time. Perfect. And now, if you have any question, we have time for questions. I think now we just in time. And if you have any question, please. Yes, Bob. Bob would have a question.
Yes.
I'm just curious, in your protocol, did you have occasions where some of your participants would have hypoglycemic responses to exercise, and how did you manage those, and that sort of thing?
Yeah, well, Bob, we were having only 2 dropouts during this study, so eventually we had got a take of 23 participants. I didn't mention that. We didn't come across any hypoglycemic events, but before that, we had done another study, I think 2 years ago, where we were actually looking for if it really happens, a hypoglycemia with exercise in people with pre-diabetes, and we had that study published as well. And the findings were, so we took the people to the level of hypoglycemia, but there were 2 types of hypoglycemia that we could. One was psychological, and one was actually chemical. So we couldn't find any chemical hypoglycemia. So the people were having the glycemic level in around 80 to 85, but that would feel a craving for eating more food. So we call that as a psychological hypoglycemia rather than a physical hypoglycemia. So,
Thank you very much, Dr. Nayak. I just forgot the question. This is dementia.
You can put the question in your language.
Yeah.
No. I translated.
Yeah, sure. I wonder, you got the patient pre-diabetic. Like me, I'm a pre-diabetic patient as well. I take medicine as well, and walk as well, and exercise as well. So what was you didn't mention somewhere the medical patients. Are they getting the medical aid as well or not?
No, those people who were
stopped.
Those people who were taking any medications, for decreasing the glycemic level, they were not included in the study.
All right.
Yeah, so this was basically, like, there are other findings in the study. We were actually looking into, if we get back, so we actually screened around 90 people and we find 25 with pre-diabetes, which is a huge number itself. So one of the findings from the study was that along with the other thing, these were the people who didn't know their status before. Yeah, so we were actually stereotyping the people. So those people who were having a greater waist to hip ratio, or who were having central obesity. So we were looking at those people and we would ask them, we would screen them, and then we would tell them about their position that I have this problem, but we have a solution for them. And that's why, like, none of them were on any medication, or none of them knew before that they had pre-diabetes.
That way you don't have the history of, they don't have the long history of pre-diabetic.
Yes.
Yeah, sure.
So that is what, because the age range was between 25 and 35.
30, yeah.
This is the age where you get the pre-diabetes, and in Pakistani population usually
Yeah,
at the age of 35 to 40 you get the diabetes.
Thank you.
Thank you.
We don't have more questions. Thank you very much for your presentation and for coming to Portugal. And now I invite all the people to come for the restaurant. One question? Okay. One more. No, you need.
I'm really interested to know, like, how many males and females included in the study?
Yeah, we have, like, in this study there was 11 females and 14 males. We were having 2 males dropped out from the study, so eventually we had 11 females and 12 males. That was eventual. I didn't got into that detail, that, like, the amount of data that we have got from this project is enormous, and that's why sometimes you cannot control the whole data, especially in 30 minutes of presentation.
Maybe you invite all to come to Pakistan and apply the knowledge in this laboratory.
Yeah, why not? And
I'm the next.
Yes, I would love to have you on in Pakistan.
Now, I invite all to eat in the same restaurant with our friend Bia. But before, I invite all to come here for take a picture before, after the lunch. Many people go for home and others out. And now we have many, and we take a picture here now, okay? If it's possible. Thank you very much.